Duna madam, you can go live, madam.
We are live now, sir.
Good evening to all. This is Chandramohan, ortho physiotherapist from Sri Samraj Physiotherapy Center, Dindivanam, Tamil Nadu. A warm welcome to all the participants in the Zoom meeting and Fitness and Rehab India YouTube channel for the ExRxIndia's and Sri Samraj Health Services Private Limited's presenting WEBATHON, a web series endorsing for the world record in association with Pickle Studio Chennai, Sairam Academy Chennai, Dusat Creations West Bengal, and powered by Dr. Venkateswaran's Stimulus Physiotherapy and Fitness Clinic, Pune, Maharashtra, India. ExRxIndia's 170th topic is significance of musculoskeletal screening and fitness training for sports players will be presented by Dr. Alagappan, MPT Sports and PhD scholar, founder and head physiotherapy department, First Step Physiotherapy Clinic, Chennai. I welcome ExRxIndia team members Dr. Rupesh and Professor Duna and associates Dr. Venkateswaran. And now I welcome our resource person Dr. Alagappan Tyagarajan and request him to commence the session. Please, Dr. Alagappan.
Yes, sir. Thank you. Yet another session with ExRxIndia. So it is a special moment for me. Like, my clinic team is participating here. My junior physiotherapist is in this group, and as a participant, and I got another opportunity to work with this wonderful platform with Chandramohan sir and Rupesh. Sir, both of them are doing a fine job with tournament. Okay, without wasting time, we'll just get on into today's topic. Let me share the screen. All right. Okay. Today my topic is significance of musculoskeletal screening and fitness testing on sports players. This topic starts like this: like when myself and Chandramohan sir was discussing 20 days or 1 month back, we have been coming out with certain discussions, and at the end, he was the one who introduced this topic. It is a very vast one, but I have done my best to make it crystal clear for all you. So that, like, my aim is like to keep this webinar a simple one and a much proactive one. So this is going to be a lot of my experience, which I have been with sports physiotherapy practice for the last 8 years. So it's like what we are doing in sports physiotherapy is what it's going to be in this presentation, the basics to start with. So this topic consists of slides where I'm going to discuss about what is a sports medicine team, and I'm going to share about what the screening available and types of aim and types and aim of screening. And we have something called as musculoskeletal screening, which is very, very important tool for physiotherapists. And I'm going to share a few things about fitness testing and its types. And we also have an overview of screening and testing forms. So what are the forms which we use in sports physiotherapy practice? I'm going to share about that also. And what research says about fitness testing and screening, we are going to view on that also, on that direction also. So when it comes like a sports medicine team, this webinar is going to be very useful for someone who is aspirant to be a sports physiotherapist and physiotherapists who are already participating with sports physiotherapy practices. When it comes to a sports medicine team, the athlete or a coach, athlete comes like if someone is doing an individual sport, athlete will be onto an action, or else the coach will be the head for a complete group event. Say, for example, cricket, hockey, football, all comes under a team sport. A separate athlete will come like badminton or a rower or a cyclist. All these are individual people. So individual people will be an athlete. So athlete or a coach will be a centric person. And thanks to Buckner and Khan, who shares this in their sports medicine book, clinical sports medicine book, where athlete and coach will be the centric person, and they will be coordinating with this multidisciplinary people like trainer, physical therapist, soft tissue therapist, or a massage therapist, podiatrist who do with a lot of food studies, a psychologist, dietitian, and a general physician. And there are some other professionals who might also come to an action like an orthotist or a yoga trainer or a mental conditioning coach, etc. All those comes under others category. But a sports medicine team is always like a athlete or a coach centric one. Yeah. What screening? What is screening? According to WHO, screening is nothing but it is WHO has given a simple crystal definition for screening. Screening is presumptive identification of unrecognized disease in apparently healthy individuals and also asymptomatic population by means of examination, testing, and other procedures that can be applied rapidly and easily. It is very easily to administer for a targeted population. So, say for example, in targeted population, you can target anything. Say for example, right now we are in COVID. COVID testing is done with targeted population. So again, like when it comes to sport, it is done with a targeted population. The main benefit or an importance of a screening is it is to optimize the effect of sports participation and training, and it is to avoid unfortunate side effects. So unfortunate side effects should be minimized, and sports participation and training should be optimized, and their effect should be a flourishing one. Focus on preventive measures. It primarily focuses on preventive measures. Generally, how screening is started is European Society of Cardiology is the one who have been seeing with a lot of cardiac arrest happening on field, and they have come up with a specific screening with cardiology. So that is how it has started in screening. From there, what it happens is subsequently it is implemented in wide varieties of some other communities. So cardiology screening is the initial screening which is started with sport, and gradually now we have come up with certain years pass by. Now we have come up with wide varieties of screening. In next upcoming slides, I will share you like what are the wide varieties of screening which is available in sport. The other thing is like a screening or a sport participation in an athlete can be a positive experience for all age category. It can boost their fitness, it improves their self-esteem, and it also enhances their coordination. So screening is going to be a very good tool for providing an opportunity to create a cooperation and competitive level for an athlete. So screening is vital for someone who is starting a sport or a sporting activity, any form of sport it be. Screening types. So we have come across a lot of screening types. Screening in general, as I said you, it is done only for preventing, and it is all those which we do are the strategies where we won't push ourselves to an injury. There are steps of prevention in screening, like what are the screening types which is available in this sense. Musculoskeletal screening, which is primarily done by us, exclusively done by us, physiotherapists. Medical screening, which is generally done by a doctor. Fitness screening is done by a strength and conditioning coach, and nowadays sports scientists are also coming up. Nutrition assessment is done by a dietitian. Exercise physiology concepts is in upcoming slides. I will tell you like what are the exercise physiology concepts available. Like there are a lot of direct testing available with exercise physiology concepts. So I will be sharing about in upcoming slides also. And there is something called as mental assessment, which is done by mostly with psychologists and a mental conditioning coach. So when it comes to screening, specifically musculoskeletal screening is going to be our important aspect on dealing an athlete or a team activity. If a team has a certain format, we are priority to go with the format. Say for example, now National Cricket Academy has a specific format for musculoskeletal screening. Whereas if you take AFF, All India Football Federation, or if you take an hockey association or All India Hockey Association or tennis association, they don't have a specific screening norm. Except NCA, there are few in India. In India in particular, there are few who doesn't have a specific screening norm. So if there is no screening on the place where you're going to work in future, you should create the format. That is very, very important. Okay. So in case of individual sport, what you have to do is like if we and the physician are going to be mostly a primary contact person in sport. So when an athlete comes across to you to reach about how their level is, how their health level is, and they are not sure about how to start about with their health level on sport, you should put them into an appropriate person. Say, for example, if you're dealing with a 13-year-old boy where he is like about to start with his fitness levels, you should put them directly onto a medical screening. You should do an MSK and you should put them in a training. So, other multiple people will come to an action, and we should be clear that where we have to direct our athlete who is coming across for a screening. And the other point is, if you feel that the athlete is far enough, if he is doing very well, yeah, then what you have to do is you need to work them on performance. That is very, very important. Performance aspect will be done by mostly with us and also with the strength and conditioning coach. Okay. Okay. Let me stop here. I just want you all people to be clear till this now. You can type it on your chat box. If it is clear, I can continue further. Let me check with the chat box also. Is that clear? Guys, participants, you can just type it like it is clear, or if you want me to repeat something, I can go again also. Others, yeah, Parul, Pragati, clear, Rani, clear. All right. So, okay, thank you. So I just want to have the session as more of a proactive one. So I want all your active involvement. That's very, very mandatory. Yeah. All right. So I've given you an idea about what is screening and what is the sports medicine team which is available, and what are the types of screening which is available in this in the sports activity level. Slide is not moving. Okay. Aim of screening is why we are doing screening. Screening is to prevent sudden death. You would have seen a lot of movies where a player will be playing and suddenly you will be in a cardiac arrest, and it also happens in multiple places also, even in the live sport also. So that's what European Society of Cardiology has come across with the basic cardiac screening. That is very, very important. So screening has primarily been decided to done with healthy individuals, and it aims to prevent a sudden death. And it also ensures our optimal medical health. That is very, very important. Say someone who is with asthma or diabetes or a depression or a female athlete with a menstrual issue, it enhances your optimal medical health. That is very, very important. And screening is also important to ensure optimal musculoskeletal health, and we are the key players on musculoskeletal health. Screening also used to aim or being used to work on more with the optimal performance, particularly with nutrition, psychology, and biomechanical aspects. And it also prevents injuries. And it also, when you deal with a young athlete, it used to be very helpful on reviewing their medications and vaccinations. And screening, particularly in cricket or any other sport, they start with the baseline data. In upcoming slides, I will share you about what is physical activity readiness, what is PARQ or pre-participation evaluation screening. I share you everything. So the baseline should be like collecting a baseline data, which consists of like blood tests or any neuropsychological test in contact sports. The other thing is like the screening is very important. It aids us to be a good person, or it is aid to have a good professional relationship with an athlete. That is very, very important. And screening is to educate. But remember, screening is a simple tool. It consists of multiple components, multiple professionals comes to an action, but the main point is MSK screening. MSK screening is our role, but we should also keep an eye on other screening, because being a primary contact person, as I said you in the earlier said, ourselves and a general physician or a sports medicine doctor, we should be clear on keeping an eye on other relevant tests which is happening around for an athlete. Okay. You have two varieties of testing and screening. One is the direct type. The other one is an indirect type. See, indirect type is a very famous one which is happening around all over the world. Direct happens very lesser. Direct test is more of like, it takes a lot of effort to perform, and it is mostly like an exercise physiology based test. So it requires lab, right? Direct test requires lab. Say, for example, I still remember my junior Dhanlakshmi, she is with Ramachandra University Sports Medicine Center, where they have a good setup, like they have a podiatry apparatus, they have an isokinetic testing. So mostly like exercise physiology concepts comes across with direct approach. And direct approach requires a direct application. It is very accurate. It has all its numerical values, and it is equipment bounded. So that's why professionals like exercise physiologists has a key role on that. It is highly expensive. Few of the direct tests are highly expensive, and it is underutilized. It is very underutilized in India, particularly in India, because like like that integrated approach is not happening around in most of the places in India. Even like Sports Authority of India is trying to bring up with some integrated activities. Except cricket, other sports are not getting along with more of integrated activity. Whereas like indirect is very famous in India. Like it is easy to perform. It involves like more of like physical screening or an MSK screening. It doesn't require a lot of expertise to administer. It is all about very simple, keeping things very, very simple. And remember, it is only predictive. Say, for example, I know Rupesh is still in, he is in sport. There are a few other participants who is also directly on the sport. Yeah, 1 second. Yeah, indirect test is like it varies from person to person who's administrating the test. Say, for example, it varies from physio to physio also. So indirect tests are numerical and it has only its own predictions, but it is highly effective. You believe me, like it is very effective, but it is only most of the prediction. It's like more of like how we do assessment. Assessment varies from each and every physio. Similar to that, screening varies from each and every physio, and also strength and conditioning people. It is least equipment bounded. Remember, like a simple equipment like a goniometer or an inch tape or any kind of minimal equipment is far enough for that. It is very least expensive and it is gaining high reputation. If you take other countries, both direct and indirect has been performed across, whereas in India, indirect is pretty famous. Yeah, clear? All right. So musculoskeletal tool, musculoskeletal physiotherapy or musculoskeletal screening is it's an important tool for physiotherapists. So what we are doing in musculoskeletal screening is we are doing an assessment to recover from a previous injury. That is very important. And during our screening, we will come across a suspect risk of future injury. That is very, very important. Note my point. This is very, very clear point. It is to assess whether your athlete has been recovered from the injury, and your screening is also used to suspect risk factor for their future injury. It is very, very important, a very vital point. The second point is, even your athlete has resumed to have a complete participation, yes, they have some considerable limitation. Okay. Say, for example, their rehabilitation process would have not been done completely. So it's our duty to check whether they are like having any functional limitation followed by their older injury, and you should have been aware that to work on components like strength, RO1, and proprioception, and if you require further more things also. So when you start with the musculoskeletal screening, questionnaire is asked to an athlete to explain their nature of their problem. That is very, very important. So in upcoming slides, I will tell you like what kind of questionnaire, what kind of forms we are using in sport, and it also used for athlete to describe the nature, the onset date, and the symptom of their current injury also. So remember, this slide is very, very important. Our screening is used for assessing from recovering from early injury. It is used to suspect risk for future injury. It is also used to check with what are the limitation and what are the limitation which we need to work, followed by the results which we achieve. And it is also useful to work on the current injury also. All right. And followed by the injury history taken, it is very important. The screening tool is very important to work on a rehabilitation program and to restore full function. So screening will aid us to design a good, proper rehabilitation program. So the outcome of your healthy screening will be a proper rehabilitation program. Remember, guys, screening is not a specified format. Again, I'm coming back to National Cricket Academy, which has been affiliated with the Board of Cricket Control India. They have a specific screening format. I still believe when I started at 2012 with sports physiotherapy practice, they have a prescribed format, which is a very lengthy one. One of my seniors from Mumbai has shared me that. Now it is concised and it is like a very specific data which is followed in cricket. But believe me, every sport is susceptible to separate varieties of injuries. So screening varies from sport to sport. Okay. So again, when you don't get an available format, as I mentioned on your earlier slide, it's our duty to work or design a specific format screening tool where you are going to work on in the upcoming years. If you are a sports therapist, believe me, or if you are an aspirant to work on sports therapy, if you don't have an assessment, it's your duty to form a cluster of assessment. Say, for example, last year I worked with the football club. We don't have a specific screening tool for working with the team. So I went through with a lot of articles. I went through with a lot of formats, and I have come up with the outcome. Even though it is not universally followed, it's for my satisfaction to do something useful for my team. So it is very, very important to integrate or to integrate with the older format if it is available, or it is, or to frame a newer one. Okay. Okay. So till now, are you guys are clear? Like you want me to explain something, you can type it on your chat box. Like I can even explain you if you want. If you want me to repeat, I can even repeat. I hope like we have enough time. You can type it on your chat box, guys. Yeah, it's clearly understandable. Others? Okay, okay, okay. I'm happy that I'm getting response. Good. Yeah. So till now on this presentation, what I've done is like I've shared you about varieties of screening, a sports medicine team approach, and what they are doing with an aims of screening and a musculoskeletal screening, which is a big tool for a physiotherapist. Okay. Next slide. Yeah. What are the contents which we have it in musculoskeletal screening? Pre-participation evaluation, which is done by the physician, is very, very important. See, if you take BCCA tournaments, particularly the junior category tournaments, I'm not sure about the senior category. I have experience with working on junior category. So in junior category, what they do is a medical doctor will do a pre-participation evaluation with X-rays and relevant tools, which is the format which board is having. Even in AFF, they have the recent AFF tournament which I done. Even they have a prescribed format on doing a pre-participation evaluation. Being a therapist, we should have a look on pre-participation evaluation. That is very, very important. And we have something called a subjective assessment, which we do regularly with physiotherapy, name, age, sex of patient, and all these basic data things. And we have something called as PAR-Q questionnaire, physical activity readiness questionnaire, which is a very good tool. PAR-Q is a questionnaire, a cluster of questionnaire which enhance a normal or a healthy sport individual to get on into a physical activity. So it is a cluster of questionnaire. I will show you those forms in upcoming slides. And we have a posture assessment sheet. Posture assessment sheet has been recommended by New York State Partial Assessment Scale. It is a very good assessment sheet. I will show you that also. And as I said you in earlier slide, we have a cluster of special tests based on the sports demand. So again, like if you have a testing protocol, you go with it, or else you form. And the other thing is to guide your even like we should have an idea about what the strength and conditioning or a sports scientist is doing. See, till now in India, there are trainers, we call them as fitness trainers or strength and conditioning people, where what they do is like they have they don't have a proper education background. They used to do a certification program and they start involved in sport. But right now, like courses like BSc Sports and Exercise is coming, MSc Sports and Exercise is coming. I know few of the therapists who has completed in varieties of universities working as a sports scientist also. But you know, like for me, like I don't recommend physiotherapists to work in both. You should be clear on working what you want. If you want to work exclusively as a physiotherapist, this is the thing to work on. The main thing in this is if you are working along with the strength and conditioning people, you should they do a procedure named functional movement screening. Functional movement screening has been designed by Ray Cook, physiotherapist. Thanks for his excellent outcome, and he has also suggested a routine called as Y balance test, and also a very good tool which is called as selective functional movement screening. Functional movement screening is something which is done exclusively by a trainer or a strength conditioning coach. Even a sports scientist will do. And functional movement screening, if it is not getting proper, we are an important person to work more on selective functional. Selective functional is ideally recommended for physicians, physiotherapists, or medical related people. I'll show you in upcoming slides like what is FMS and what is selective functional FMS. Remember, functional movement screening and selective functional movement screening is not a mandatory one for our assessment. But we should have an idea about whether if your trainer is doing FMS, you should have and help, you should aid them to work on their selective functional movement assessment. That is very, very important. Clear? The last one is based on your screening tool, you should frame a good rehab exercise protocol, and you should use your outcome measures scales. Outcome measure scales is very, very important. Whether your athlete has come out completely, you should go with the complete. Yeah. Right. Yeah. This is the pre-participation evaluation sheet. This is, I have been finding out like in varieties of website. I got this. I'll also share with this. So this consists of, it is a quite smaller one. Kindly pardon with me. It has general questions. It also has some heart related questions. I'll share it with you. Like it consists of mostly with medical issues and their previous medical issues related questions. Okay. I'll share this with you, but it is a very simple form. The next one is PARQ. PARQ is something like a set of questionnaire which involves like, you have a heart condition, have you been done any physical activity earlier, do you have chest pain? It's more of like a medical condition which is relevant to exercise. So PARQ is completely done by us. Yeah. So PARQ is also a very good one. It is available everywhere, and it also has an informed consent like I'm eligible to get on into a physical activity, and you can have a note with your athlete with their signature also. Partial assessment, as I said, you like this has been designed by New York State Partial Assessment Scale. This has 3 categories: perfect, fair, and poor. So it has been evaluated for 100 marks. So if you get perfect, you will get 10 at each column, and fair you will get 5, and poor you will get 0. So it has its own reference point, starting from your head, shoulder, and spine, then to your lower extremity level also. It is a very good one, and it has a lot of validatory, and it is universally followed also. This posture chart, you can have a view on Physiopedia. Physiopedia has given an enough clarity about the New York State Partial Assessment Scale. And the screening sheet, which is very, very important. See, this is a screening sheet. I have given you an example screening sheet. This is a screening sheet for a rowing athlete. In this, you can see there is certain cluster of special tests with flexibility level, the joint level also, both in thoracic, spine, and scapula they have taken, and there is also some ergonomic related assessment. See, followed by the parameter which you design or the special test which you do, you have a numerical reading, and you will have a comment box like what you have derived from the special test. You will have a comment box, and followed by that, based on the dysfunction which you evaluate with the screening level, you need to design a specific exercise protocol. That is very, very important. Yeah, clear? So screening sheet is very, very important. So as I said, you like PARQ, posture, and screening sheet is the most important for physiotherapists. So it's our aim to make our athlete to do a proper program or a protocol, and followed by that, they have to get on into a training methodology. Okay, this slide gives you a simple idea about what is functional movement screening. Functional movement screening is a wide, vast topic, but for your understanding, it is consist of like 7 basic movements, which involves your functional daily activities or functional athlete activities, and you have a 4 categories of screening scores in that. Depth functional movement screening tool is been available again in Physiopedia. I can share it on a group also, or else to Chandramohan sir in person, where you can have an idea about functional movement screening. I should thank one therapist who is in US who helped me to learn FMS. He has shared his book, and it was like wonderful. He was a foreign physiotherapist. His name is Chris. He's working with ATP. So Chris sir has been helped me around with functional movement screening and selective functional movement. Selective functional movement is consist of like a top tier assessment. You can simply classify as like a breakout assessment for each and every category. I can give you a proper clarity. We all will be doing selective functional at one way or the other. Say, for example, even in your clinical practice or when you're dealing with an athlete, if someone is coming with a neck pain along with a shoulder issue, you will have a cluster of special tests to detect whether it is spondylosis or some other rotator cuff pathology or any other things which is related to your neck and shoulder. So, similar to that, Gray Cook has a breakout pattern. Gray Cook is the one who discovered functional movement and selective functional. He has a breakup pattern. And what he did is this breakup pattern has been specifically followed by a doctor or a sports medicine consultant or a physiotherapist. Only medical relevant people could be able to do the selective function. That's why he said FMS is a content which everyone can do. It is applicable for all, even a coach, even a parent, even an athlete himself can try a test in this. It is a very easy, simple tool. But when your trainer or when your allied people, when you're doing in a teamwork, if they come out with FMS and they say like, I couldn't be able to do with what is selective functional, then you have to work on selective functional movement assessment, derive some protocol exercises, and to achieve their proper outcome with FMS. Clear? All right. and followed by selective functional. Selective functional is also, I think I have missed one in this. We have vestibular screening in selective functional also. Yes, there is around 8 breakouts, which is for upper extremity, multi-segmental flexion, multi-segmental extension, and rotation, which is more on the spine related. Single leg stances for proprioception, and a squat pattern is for the lower limb evaluation. And we have some screening for vestibular also. So I missed that in this. So it is a cluster of breakouts. SFMS is a cluster of breakouts. Followed by that, designing a rehabilitation program is very, very important. You have levels in rehabilitation program. We all get used to rehabilitation program. Even if you're dealing with an ACL patient, you will start with the basic and you will go with an advanced to complete their complete process of rehabilitation. So till after you derive a result from your MSK screening, you should put them in a proper rehab. Either if they are injured or not injured, it should be their body specific, and you should put them in the proper rehabilitation exercise space. That is very, very important. Okay. So with this, we have cleared musculoskeletal screening and what we do mostly. If you guys want me to explain again in something, you can type it in chat box. Next, we are going to see about fitness testing. Yeah. Is that clear right now? You want me to explain anything, guys? I couldn't able to see the chat box. Yeah. Good. Good. Okay. All right. All right. All right. So I'm going at the right track, I think. Yeah. Yeah. Thank you. Thank you. Thank you, guys. Okay. The next one is fitness testing. So far we have seen what is musculoskeletal screening, which is the most important for therapists. Now it is fitness testing. What fitness testing is, like followed by ours, it is going to give you insight about their physical condition. So you can keep it as simple. Last night I was discussing with one of my senior therapists, Srinivasa Rao sir. He's a former Indian under 19 team, World Cup team winning team physiotherapist, cricket team winning physiotherapist. He has a vast clinical experience. When I was discussing with him, he said, like, in simple words, physiotherapists, we will be doing more of joint related screening. When it comes to fitness, trainer or SSC, SNC, strength and conditioning coach or a sports scientist, they will be doing mostly with their functional screening. Functional is like movement or a performance based testing. So we deal mostly with injuries and preventing injuries, and these people will be working with again, they also work on preventing injuries, but it works more on function and we work more on the joint level. Simple as it. We can keep it as two simple ways. In a simple way to understand, we do it in joint, they do it at functional or a movement level. So what fitness test does is, it gives you an insight about current physical condition, and it monitors. Testing also useful to monitor particularly direct testing, exercise physiology based testing. I remember when I went to Inspire Institute of Sports in Bellary, they monitor regularly with isokinetic devices, and even the exercise physiologists do the sleep study also. It's very effective. So indirect testing will also, direct testing, indirect testing is something which we all do right now, which we all seen right now. Direct testing is useful for monitoring the progress and its training efficiency. So when it comes to monitoring, direct testing is very useful. It motivates the athlete to keep them training, and it also useful for designing a good parameter or a new exercise program design. So what is testing guidelines? See, when you're a trainer or when you are involving on designing a testing guidelines along with the trainer, since I said you, like, now only strength and conditioning professionals are coming up, you might have a role to involve in them with designing a protocol on testing also. Sometimes. When it comes like that, it should be more relevant and specific. You should have a look about what is the energy system which is involving, either aerobic or anaerobic or creatine phosphate, which sport it is and what kind of energy system it is involving. Yeah. Level of injury happening around. Being a therapist, you can guide them properly that this kind of injury is happening around in this sport. And medical and MSK screening, which we do and a doctor does, it's very, very important before starting a fitness screening. So, like all these things are mostly interlinked. Fitness components with assessment, we should design I'm going to share what are the components which also involves in fitness testing. So you will have an idea about what are the fitness components and what are the assessment you can decide according to that sport level also. And other consideration, whether your team is requiring like a massage service or a diet assessment or any other supportive services. So very important. So when it comes to fitness test, you have two varieties of fitness test. One is like health related, and another one is skill related. Health related consists of like endurance, speed, strength, flexibility, body composition, all comes like health related. When it comes to skill related, it consists of agility, coordination, balance, power, and reaction time. So you can have an idea, gross idea. Health is like to keep their energy levels and their health level into the normalcy, and skill related test is useful for their sport level. So your testing should have all these components with health and health level also, and also with the skill level. Remember, musculoskeletal screening doesn't have a proper structured protocol, because we know we have lot of special test comes and it varies from sport to sport. But when it comes to fitness testing, it has its own uniform structured assessment. I'll show you what we are doing in our clinic also and what is happening in the universe also. The other thing is like we will have a very small variation in fitness assessment designing. Whereas when it comes across to musculoskeletal screening assessment, it is vast. The structure is very vast. Make sure the factors which is considered when you are choosing your special testers, it should be a relevant one, it should be a specified one, it should be very easy to administer. That is very, very important, because we have a lot of role to work on with the athletes, either at the individual or at the team level. It should be a valid one. Make sure the test either on your screening or also on the fitness testing which you are going to administer should be a valid one. It should be under the sports norms and criteria, and it should be equipment bounded, and your equipment should be feasible. That is very, very important. Equipments which you do it with sports should be feasible. This is a formal fitness assessment sheet which is followed universally. You have like you can have a subjective, even they have a subjective basic data, and skin fold assessment which they do it with skin fold caliber is there. So they have a specific site for men and women. So they do it with skin fold caliber. Followed by that, waist hip ratio is a common one. BMI is to detect how much weight is they are, and it also works on their weight level also, what kind of weight they have to get on to become fit for that specific sport. And you have an anthropometric assessment which gives you an inch tape level assessment on measuring your shoulders, thigh, abdomen, and everywhere. Anthropometry is a tool which used for what kind of loss you have, loss or gain with the weight level which happens. So it is a very good tool. Followed by that, you have a specific cardio test. You have a test for resistance. You have a test for core. Remember, core we can also add it on to our component, or else it's going to be on the trainer component. And there are some specific muscle specific flexibility test also. But remember, we do mostly with joint specific. They do with muscle joint specific, and along with that movement specific is being done with trainer. Yeah, or a strength conditioning coach. So flexibility test and resistance, core, proprioceptive, along with their skin fold caliber, are these components which comes with health related fitness assessment. There are a few components like agility test, which in simple, which we call it as a vertical jump test or a sit and reach test, and there are some sports specific tests. You would have heard about yo-yo test. All these comes under skill related test. Make sure this assessment form which I am showing you is a complete health related assessment form, and if you want, you can add skill related assessment onto this health related fitness form also. So make sure component matters. Components depends upon the sport, demand matters. This is the one which we used to do it in our clinic, a simple PARQ along with the diet data. So this I've given you for having a first initial page. Followed by this, you can have this page should be a mandatory one when you are designing an assessment. Followed by that, you can have a variation about what kind of health or skill components which you need to include along with your assessment. Followed by that, we used to have a rehab program design, and your trainer or a strength conditioning coach will have a program design chart. The program design chart will have what kind of warm up they have to do, strength training, which includes both health and skill related strength training exercises, cardio training, which you want to prescribe, and the cool down one. So this format has been prescribed by a trainer. So once your MSK screening is done, trainer will administer a specific cluster of special tests, and from there they will derive this program design chart. Okay. So how to progress after testing and screening, which is on our perspective. Okay. Guys, are you clear till this? With this, we are completed with fitness screening. Shall I proceed further? Yeah, clear. Sorry for keep asking you all, guys. Like, this is a quite vast topic. I want to make sure that you all understand properly, which is very, very important. Guys, shall I proceed? Yes. Samima Masuda. Yes, I can send you the PDF for sure. I can send you the PDF. I will do it with Chandramohan sir, and sir will do reach all you in the group. Definitely, I will do it. Thank you. Yeah, let me proceed further. Okay. So far, we have seen MSK screening and fitness testing. And now the last part. How to progress after testing and screening in physiotherapist perspective. In our perspective, we should believe on teamwork. See, we should be a very good team player. Being a team player is very, very important. We should believe on teamwork. First, we should work as per the result which they derive from the fitness assessment. Say, for example, if after the fitness assessment, your player is prone for an on-field injury. Yeah. So, your fitness assessment results is also important. Make sure when an on-field injury has happened, we should have a team bondage work. This work is very, very important. Working along with your professionals is very, very important. Referring to a proper doctor, referring to a masseur, working along with the strength and conditioning people, or to a dietitian, very, very important. So make sure you work as per the document base. Remember, document base makes lot of sense. Framing a rehab program is very, very important, and we are the eligible person to do that. We should also involve ourselves in fitness program design. We can also share our outputs to the SNC, so he can also use our outputs to design the program design for the athlete. You should frame the protocol, work along with other professionals, as I said earlier. After forming the rehabilitation protocol, also you should work along with other professionals. Like it's more of like a hand-to-hand job. See results based on the outcome measure tools, which is very, very important. See, your athlete might cheat you sometimes, even if he's recovering. We never know whether he's on the right direction. So let's ensure that screening tool will give you a crystal clear clarity that he is progressing in the right way. Yeah. And there are some other components which involves, like, even if they're psychologically down, they never say like we are not improving. So a tool will give you a proper idea, like this is the progress, this is how he is getting better. So tool is very, very important. You should 1 second. Yeah. Once you do the fitness assessment, fitness reassessment should be done, and also a rescreening can also be appreciable. But like if you want to have a progression, you have to do that. If you're working with an athlete in a long term, say for example, if you are in a contract with a sport area like Sports Authority of India, or a long-term contract with a big team, you can do a reassessment 8 weeks or 10 weeks recurrently. Whereas if you are working in a short contract, ensure stick on to the basic, finish your job, give your outcome to your athletes who are at the event, who is an individual or a team one, and you make them to perform as per your guidelines. Make sure monitoring and documentation is the key factor on designing a rehabilitation protocol and also a fitness testing. So that is very, very important. So when it comes to athletes will get benefit from their baseline fitness level. They could come to know that what their fitness level is. They can compare their results with the other athlete also. Comparing again, it is a worse thing, but yes, they can. Each sport has a specific parametrical demand. England Cricket Board has a very specific parametrical demand for their cricketers. So when it comes to a parametry, athletes can compare their results to the requirement results. That is very, very important. They can identify their weakness and strength when they're involving in their fitness program. They can design a program for their own. Say, for example, a lot of their athletes get to use their own rehabilitation protocol, even which they derive from their older physiotherapists or the current physiotherapists who are working with. So they can do their exercise program on their own also. It is very useful if in specific individual sport. And monitoring the progress is very important for an athlete. They can assess their fitness goal. And what the other thing is, like, when they're working on their weaker part, it provides incentives. It provides incentives and it helps them to work on their upcoming time also. and they gain entry to become a far better player once they start working on with proper assessment and tools, and they can also aid us to work on research activities. So I'm going to share you some articles which is like supporting screening and testing. So this article, which has been Chabini, Negra, what this article specifics they have done with Olympic contact sports. And this article gives us an idea, like lot of varieties of testing and screening processes happening around the world. Still, it is not a fixed format. It varies from topic, sports, gender, and age category specific. The other article, you can see like what this article has given you a clear crystal idea that about like when someone is having an injury, a test for balance, a test for flexibility, test for muscular endurance, as well as BMA can be implemented as a screening tool. So it can be implemented as a screening tool to identify the person with risk factor. So even screening tools is also useful for identifying the risk factor. So this article gives you a clear idea about it is useful for identifying. And a sports specific assessment, this article from Zemkova, he has given a clear idea of that not only sports professionals and exercise practitioners, all other relevant professionals like physical educational teachers, therapists, physicians, and some other people who are working with exercise relevant should have an idea about what is sports specific assessment. So that is very important when they are dealing with an youth or an young athlete. This article gives us a clear-cut idea about pre-season musculoskeletal screening and functional testing with elite basketball players. This article gives us that it is done in Russia, and what this article gives us is it is a reason one also. This article gives us it is not done when the screening or testing is not done in a teamwork and not with a proper qualified professionals. The work ethic spoils and the outcome measure of the testing spoils. So this happens mostly in India also. Still, like we are trying to work more and more based on the requirement, and let's ensure that we are working with for professionals. So we have a good educational background. When we are trying to work along with someone who is with basic level, it's us. We need to help them to get along with our knowledge requirement. So let's help around the near par professionals also. But like this article is a very important one because the data spoils data and the teamwork is not happening. If the teamwork and the professional ethical level in screening and testing is not happening, the purpose of doing the work with the sport team gets spoils. So let's ensure we have to do in a proper way. This article from exercise testing for sports and exercise prescription, what they have done is Balandi from Australia. This is also a very good article. It gives you an idea about exercise testing is a useful tool on establishing activity, and it is highly beneficial on preventing injuries. So it is the indirect testing method should be hardly encouraged. It is very, very important. And planning initially on how to work on screening and testing is matters. So we should work on the plan whenever we are going for an event, whenever we are taking an assessment or an assessment with an individual level, or else an assignment with a team level. We should have a plan how to go about it. Yeah. All right. So with this, I conclude the presentation. I should thank 3 members for this presentation. One is Saravanan sir, Professor Saravanan, who is a well-experienced academic sports physiotherapist from Sarvajani College of Physiotherapy, Gujarat. Sir is an excellent sports physiotherapist, well-experienced one. The other one is Srinivasa Rao sir, physiotherapist, former Indian cricket team under 19 cricket team. And my guide Arunachalam sir. Arunachalam sir is a wonderful person. Sir is the one who introduced me to Chandramohan sir, and that's how I got mounted with the ExRx team. And last but not the least, my wife, she was helping me around to design this slide. I was been trying around to do my best for last 2 to 3 days, and she was been helping me around. So thanks a lot. With this, I conclude my presentation. Guys, I want to have a good question and answer session. Let me come back, sir. Yeah.
Thank you so much, Alagappan, for a wonderful session.
Thank you, sir.
Already there were 2 questions. Some were asking that Motarwala was asking something, and Pandu Rangarao were asking.
Yes, yes, sir.
From Pandu Rangarao, when and where to implement this FMS?
Okay, very
Functional
good.
motivation.
Very good question.
Yeah.
Guys, even if you want to have any questions, just feel free to ask. I just want to have a good question and answer session to ensure that you have learned something from this webinar. Okay. Sir, when and where we need to implement FMS? Is that the question, sir? Yes, sir. Yeah. See, FMS is something like when your musculoskeletal screening is done, trainer will have a specific cluster of health and health related tool and also skill related tool. Along with that, they will also include a FMS tool. Okay. So FMS tool has been it is mandatory for all the sport, and a trainer will be implementing a FMS program. Followed by that, if you have any dysfunction from the FMS, it's our role to do a selective functional movement assessment and to aid the trainer to get the proper norm on the functional movement screening. Am I clear? Pandurangarav, am I clear? If you want me to explain again, I can also. Yeah. So in simple, I'll tell you, trainer will do an FMS. FMS is having a cluster of 7 basic movements, and when the 7 basic movements is getting a dysfunctional painful scale on the reading, then the trainer will refer us to selective function. But as I said you in our presentation, MSK and FMS, when you're doing an MSK, FMS is not a mandatory one. But if your trainer does FMS and if he wants you to help him on selective function, you need to design a protocol based on your selective functional movement test, and from there he will get your trainer will get a proper norm with his fitness test. Okay, it is a very vast topic. Even I love to present one more with ExRx if I got an opportunity. FMS and selective function is a very important tool for therapists. Yeah. Yes, sir. Next question, sir. Yes, sir.
Yes, the next question is from YouTube viewer.
Yes, sir.
Arokya Raja. Any role of PFT test in sport fitness screenings?
Very good question again. Pulmonary functional test has been primarily done by a physician. Basically, physician involves, particularly chest physician involves. Failure of that, exercise physiologist will implement that. You should have a look on that reading. If you're athlete or an individual people who wants to do exercise, you should have a reading that whether he is having some dysfunction on that. Based on that, you can also have some exercises with related to your pulmonary function.
Okay, yes, thank you. Next question is from Professor Satya Raja. Can screening help to decide or determine what sports suits you?
Hi Satya sir. Yes sir. It used to determine. Sometimes screening gives you a valid idea about what sport we can choose. So it is also good to do it at the young level. In fact, like at upcoming years, I'm pretty much sure many will do screening before they start a sport practice. Even at 6 or 7 years, it doesn't matter. But yes, it helps you to put your individual person or a team person to their appropriate sport. So choosing a game is screening will aid them to choose a good game. Yes, sir.
Any other questions, Rupesh?
No, sir. Anything from YouTube, ma'am? Sir, actually, in under 14 cricketing camps, they are doing that, sir.
Pulmonary functional test?
No. That screening helps or determine what sport suits you.
Yes.
For example,
yes.
a player goes as a batsman, their coach is changing them to a bowler or a spinner.
Exactly.
Depending upon long legs, they are changing. For example, Ishan Sharma can only bowl because of his tallness.
Exactly.
So, same sport, they are changing their role in that sport, sir.
Exactly. Well said, Rupesh. When it comes to one sport, your screening helps. But like I still remember there are few people who wants to get their screening and testing before choosing a game also.
Yes, sir.
So a value on this also helps them to choose a game. So it is vice versa. It helps in both. As you said also, it helps in both. No doubt in that.
Rupesh, Suresh sir is raising his hand. Can you please unmute him?
Yes, sir. But now he lowered his hand. Suresh sir, you can unmute, sir. If you have any queries, you can.
Please unmute.
So, nice presentation, sir. Nice presentation.
Thank you, sir.
Already we attended the fitness in Madurai also. from under
Oh,
you.
oh, hi, sir. Hi. I've taken earlier, sir. Should be long years back, sir. Amir, sir, has organized that.
4 years. Okay. Okay, so very nice lesson. That's why I raised my hand.
Thank you,
Okay.
sir. Thank you, sir.
Thank you.
Thank
Thank you so much. Dear participants, any other questions? Please raise your hand or put in the chat box. And YouTube viewers, please, you can write your doubts in the live chat box so that we can read it here. Don't worry that you are not in Zoom meeting. And Motorwala, you have raised your hand. Rupesh, can you please unmute?
Yes, sir. Abdelili, you can unmute yourself. Yes, it should be for attendance purposes.
I think.
Sorry,
Yes.
sir, it was by mistake.
Yeah, fine.
Yeah, okay. It's okay. Nice. We will conclude now.
Yes, sir.
Yes.
So, what I will do is, sir, I will send you the forms, sir. What are the screening forms? I'll send it to Chandramohan, sir. You can.
I will share in the group. Yeah, no problem with that. And thank you so much, Dr. Alagappan.
Thank you, sir. Thanks for the opportunity, sir.
Of course, you are
One
having a
more.
lot of opportunities to take the next topic also.
Yes, sir. Yes, sir.
There is-
I think
there
someone
is-
is asking,
Another
sir.
question is there, sir.
Yes, sir.
Yes.
So from Dhanlakshmi, sir, whether there is any difference with age group like younger players and geriatric players in screening, sir?
Very good question. Dhanlakshmi, I hope remember we have done a few with our clinic also. Dhanlakshmi works with me in clinic. So the point is like when it comes to a younger generation, like or a youth player, there is some restriction for doing a screening. Like there are certain tests which is not at all mandatorily required. Same applies to geriatric category also. Some baseline test is mandatory for them, and certain skilled, let's say for example, a geriatric athlete cannot be able to do a multi-segmental activity. So any skill related or a big health related assessment can be avoided. Say for example, if you do a one-arm test, I'll give you a proper example. When you're testing an athlete, someone between like 15 to not 15 or 18 to 25, one arm can be an applicable one. Whereas when it comes to geriatric category, one arm is not a mandatory one. So like you can choose, as I said, like it is not a predetermined one. It varies from sport to sport, and you can choose what is the best for their requirement. But let's make sure we have to do an assessment. That is very, very important, because in sport you don't have a specific one. Even in Western countries, there are a lot of things going across, like to determine a constant focused screening on each and every sport. But still, it is in a continuum process. Yeah. So this is what it has its own bounds and restrictions.
Yes, sir.
Any other questions?
What is the difference?
Can you please check YouTube once, madam?
Suresh sir wants to ask, sir.
Yes,
Since
please.
in YouTube.
Yes, sir. What is the difference between the general musculoskeletal screening and the functional movement screening?
Okay. Sir, the general musculoskeletal screening is, as we said, like we will have a subjective assessment, PAR-Q, and a cluster of special tests. Okay. So functional movement screening is something completely done with the movement specific pattern. See, special test is different. Doing a movement specific test is different. Okay, sir. So when it goes like a movement specific screening, FMS comes to an action. So that is not done by us. We are a joint expert and we are a muscle expert, and we are bound mostly with special test screening. But when it comes across to FMS done by trainer, and it is basically movement level. Once the movement level lacks, then selective functional movement screening will be done again by us. So you have to, as I said, you like musculoskeletal screening is far enough. But when your trainer does FMS, and if he needs a clarity with selective, then you need to do a selective. So we should have a knowledge on doing a selective functional movement. That is very important, sir. Yes, sir.
Fine, sir.
Yes. Thank you, sir. Thank you so much for your active participation. And any other questions from YouTube?
No, sir.
Okay.
No more questions are there.
Okay, thank you. Thank you, Dr. Alagappan, once again. And we will sure have a few more topics also, maybe in the month of October or November, because this WEBATHON will be going on till mid of September. So we need some rest actually. After that, we will restart.
All right. It's like a very long activity, sir. I'm very happy to be part of your world record event also, sir. I'm really glad.
Yes, of course, we are very happy. Every person's support and contribution is counted either the as a participant or presenter, because we have reached more than 20 countries. In fact, 23 or 24 countries.
Wonderful.
We have participants and resource persons, and so everybody's presence is counted in, and we are happy that we have a lot of support as an attendee or as a presenter. So we are happy about it. I would like to thank all the resource persons in this regard and all the participants, because without them we are nothing. Just we two can talk.
Correct.
Okay. So unless
valid.
participants are there, so everybody's presence is important. And of course, our ExRxIndia team members, Dr. Rupesh and Professor Duna, they work a lot actually. They work day and night to set everything's put in a place so that the next day the show will run smoothly, and releasing certificates within 24 hours. So much things are happening. Okay, so much tireless work, and we are giving opportunities for fearless freshers and PhD scholars. So everything is going in the right way.
Yes.
Hope we will set this world record with a good number of topics, and also good number of participants list with good number of hours and good number of countries.
Yes.
Covered.
Thank you, Rupesh. Thank you, Duna ma'am. Thank you.
Thank you all. Bye bye. Good night.
Bye.